All right. I think I'm gonna kick off. All right. So I hope everyone can see my slide. So I'd like to first thank the Las Casas Institute and Angus for this opportunity to present my research, which was done as part of my master's degree in Christian ethics last year at Blackfriars. My name is Joseph. I'm a health economist working at the Nuffield Department of Primary Care Health Sciences here at Oxford. So today I'll be speaking on the topic of rule of rescue and whether this can serve as a principle governing healthcare allocation. I'll be approaching the issue from a Thomistic perspective, that is, based on the writings of St. Thomas Aquinas and his followers down the centuries. I also have a disclaimer. I'm aware that some in the audience are theologians who haven't been exposed to health economics, but others are health economists who have been exposed to theology. So this is the classical challenge of interdisciplinary research. So to meet this challenge, I've tried to use lay language as much as possible and to explain core concepts at greater length, but it might come across as quite simplistic to experts in one field or another. But I'm aware that I probably have been 100% successful in that regard. So if you have any questions or if you thought some of my explanations didn't make any sense, please don't hesitate to contact me. All right. So what is the rule of rescue? A working definition is the tendency to prioritize the care of identified patients in severe immediate need over more cost-effective prevention. It's often seen as a specific case of a phenomenon called identified person bias. This in turn can be defined as a greater inclination to assist identified persons at risk of harm than to assist unidentified persons who are at the same risk of harm. I've highlighted the words identified and unidentified because the key issue we'll be discussing is identifiability and whether this has any normative significance. Sometimes people try to defend the rule of rescue by saying that it prioritizes severe need. But prevention can also address severe need from happening in the first place. Or sometimes people say the rule prioritizes harms that have already occurred rather than those that can potentially occur in the future. But temporality of the harm shouldn't make an ethical difference. A harm is a harm. If anything, most people would agree that preventing the harm before it occurs is more desirable than addressing it afterwards. So to repeat, what we'll be discussing today is whether identifiability per se has any normative force. Identified person bias is observed in many fields of life. I think most of us would have come across in the news stories about millions of dollars being used to rescue miners trapped in collapsed mines. And when the operation is successful, we never think that money and resources have been ill spent. But we often fail to point out that not even a fraction of those resources is spent on relatively cheap safety devices to prevent mine collapses in the first place. The suspicion here is that there is something about the miners being known and identified that is making a critical difference when it comes to our collective response. The news show their names and photos, and we've watched the interviews of their family members, etc. And this identification appears to draw far more spontaneous emotional response and far greater energy and resources from us than if they had not been identified. Identified person bias is actually a very well-researched phenomenon. In studies on this phenomenon, people are typically randomized into groups that face different scenarios on charitable giving to, say, children who have been affected by a disease or a natural disaster. The difference between groups is that in the first group, participants are given no identifying information about the victim, while in the second group, the participants are given some identifying information, though not a lot, typically a fictional name, age, and a picture. But even this minimal identification tends to greatly increase, so in this particular study, nearly double the level of donation to the identifiable victim compared to the unidentifiable victim, sometimes called statistical victim. Interestingly, when a third group of participants is included and is given identifying information on the victim and statistics on the scale of the disaster's impact, the donation level actually falls to a similar level as that for a statistical victim. So statistics really turn people off. The lessons from all these haven't been lost on the charities. You'll find that their fundraising materials are full of identifiable pictures, stories, and names, and statistics are hidden away in the back page, if included at all. So Turning now to the rule of rescue in the healthcare context. The term was originally coined by a scholar, Albert Johnson, in an article titled Bentham in a Box. He describes in this article the clash which he saw as inevitable between utilitarianism that dominates the health technology assessment field. Utilitarianism is the principle to maximize health benefits given available resources, and the instinct of healthcare professionals to carry out rescues. We could give a more concrete example from the field of HIV/AIDS policy. For decision makers of countries affected by the HIV pandemic, they have a range of options. They can increase access to antiretroviral treatments prescribed to identified patients suffering from AIDS, or scale up preventive interventions like distribution of contraceptives to reduce the incidence of HIV among statistical lives. Here it's important to note that although the cost of medicines for HIV has fallen dramatically in recent decades, when you compare medicines directly to preventive interventions, it still remains the case that prevention is far more cost effective. So, based on this, for bioethicists like Dan Brock and Daniel Wickler at Harvard University, decision makers should, as far as possible, prioritize prevention over treatment to maximize the number of lives saved at the population level. We turn to another high-profile clash that occurred between benefit maximization and the rule of rescue in a healthcare context. This happened in the US state of Oregon in the 1990s, and this episode is well documented in this article by David Haddon. In 1990, the Oregon Senate passed a law to reform the state's Medicaid funding of healthcare for poor households. The initial reform plan focused on benefit maximization and used a method called the bookshelf approach, which is widely used by health economists today to design benefit maximizing healthcare budgets. In this approach, you rank the service options that could be funded according to their net health benefit in monetary terms. So in Oregon, they have 709 service options. You then stack up the options from the top ranked, i.e. the most cost-effective one on the far left, right, the highest net benefit, then the other ones in decreasing order of cost effectiveness until your budget is fully spent. In Oregon, this happened after stacking 587 options. But this resulted in some counterintuitive rankings. For example, tooth capping was ranked above appendectomy. Reconstructive breast surgery was ranked above fracture treatment. And treatment for thumb sucking was ranked above treatment for AIDS. The concerning pattern was that procedures that generated small benefits for many individuals in the population, like tooth capping, were being prioritized over life-saving but often costly treatments required by a small number of patients, like appendectomy. This initial reform plan led to a public uproar and quickly led to the plan being rejected by the state and federal legislature. What's actually very interesting is what happened afterwards. So in the second reform plan, stakeholders were able to rank the service options without referring to cost effectiveness or even cost. And the table on the right here shows the results of that ranking exercise by stakeholders. The service options were first grouped into categories, and these categories were then ranked. And it's very interesting that these categories are actually defined by types of medical rescues. So in the top ranked category, you have very effective rescue. You have very effective rescues like appendectomy, which prevent imminent death and achieve full recovery. Then you see in the third place, relatively effective rescues that prevent imminent death without full recovery. And only then you have various prevention categories. So you have prevention for adults ranked 9th. That's below prevention for children. And then you have various kind of prevention for adults, less effective ones clearly kind of ranked 2nd from the bottom. And you have various kind of non-effective rescues and interventions right at the bottom. So for David Haddon, who observed this ranking process, this significant re-ranking of service options occurred because the rule of rescue trumped the principle of benefit maximization. And this occurred because, quote, people cannot stand idly by when an identified person's life is visibly threatened. But I think we should note at this point that the Oregon episode is not a simple story of good triumphing over evil, compassion over hard-hearted Scrooge. We live in an age of so-called medical inflation, where medical progress is measured by development of high-tech drugs and equipment. These technologies are innovative, but increasingly costly. In this context, it's not right to say that health care decision makers should not care at all about value for money. At some point, to make the system sustainable, some form of rationing and value for money calculation must take place. This then brings us nicely to the UK and the work of an institution called the National Institute for Health and Care Excellence, or NICE. Among many other things, NICE sets the clinical guidelines for the NHS and makes decisions on what new medical technologies are funded from the NHS budget. Its influence and reputation extend beyond the UK, and its clinical guidelines and approval decisions are watched and followed by many other national healthcare decision makers. So it's quite significant that NICE firmly and consistently takes a position against the rural rescue. This is stated in their public statement of its key principles. Rural rescue, according to NICE, is, quote, the desire to help an identifiable person whose life is in danger, no matter how much it costs. So this is an extreme form of the rule where cost doesn't matter at all. NICE feels that the rule works against its overall mission to cater to so-called overall population need and to ensure value for money. But the full story is quite complex because NICE runs a program called Highly Specialized Technologies, or HST. This is a program that decides the NHS funding of so-called ultra-orphan drugs for very rare diseases. These diseases affect only around 10 new patients per year in the whole of UK. The main trouble with these drugs is that while they are effective in improving the life of patients, because the number of patients is so few, the per patient cost of treatment is very high. Just take this recent case that was reported in the BBC News. So Brineura is a drug for a very rare condition of childhood dementia, and it costs an eye-watering £500,000 per person per year per patient. Another key feature of these ultra-orphan drugs is that because the condition is so rare, the patients are essentially identifiable, if not identified already. In fact, their cases generally attract a lot of media attention, as this BBC article itself shows. And you can see how it will be extremely difficult for NICE and the NHS to refuse to fund treatments in such cases. Overall, there's a general consensus in the academic literature that public funding of ultra-orphan drugs is a classic example of the rural rescue being put into practice. So, given its principle of rejecting the rural rescue, you would expect NICE to reject the funding of ultra-orphan drugs. But what actually happens is very much the opposite. Through the HST program, NICE actually relaxes its cost-effectiveness threshold significantly to facilitate the approval of ultra-orphan drugs. Bioethicist Victoria Charlton argues, convincingly in my opinion, that NICE probably unintentionally applies the rural rescue through the HST program. Charlton then rightly points out that what is at stake is the entire credibility of NICE, since its central principles are consistency, transparency, and accountability. And it's certainly not transparent why NICE publicly rejects the rule of rescue, yet actually practices the rule while giving no reason for doing so. What all this demonstrates is that rural rescue is not something decision makers can easily reject and write off as irrelevant. Particularly in healthcare, the rule seems to be something deeply ingrained in the very meaning of healthcare and the very vocation of healthcare professionals. Despite NICE's firm, conscious commitment to benefit maximization, he seems to be drawn to the public rule instinctively, as almost all people are when they see the face of someone in dire need. It's worthwhile at this point, watching the time as well, to note that there are health economists who support the rural rescue and do so from a consequentialist perspective. So by consequentialism, we are talking about ethical stance where all that matters for decisions, or the most important thing that matters, is the balance between good and bad consequences of an act. For consequentialists, things like the nature of the act or the intention of the actor do not matter or matter very little. John McKee and Jeff Richardson are two health economists who make such a consequentialist argument for the rural rescue. Their argument can be summarized in this graph on the right. Essentially, they argue that a rescue act brings satisfaction, what they call utility, not only from the direct health benefits of the act, which can be quite small, but also from the indirect benefits, what they call externalities, gained from performing the rescue. By externality, they're here referring to that warm emotional satisfaction from doing the right thing. And crucially, the total utility from both direct and indirect benefits of a rescue could be greater than the total utility gained from a non-rescue intervention. But this line of argument is problematic. First, it doesn't explain why performing the rescue generates externalities that are worth counting in the utility calculus. McKee and Richardson simply argue that such reasoning is not needed. It's just an empirical fact that people do gain the externalities. But even the most hardcore critics of the rule would accept that these externalities do exist. Their main contention, rather, is that these externalities shouldn't be counted in the calculus because there are errors in human psychology, which a rational decision maker should not count. McKee and Richardson would presumably argue back by saying that one cannot be selective in that way in what utilities count or not. But even for them, there would presumably be circumstances where they would have no option but to be selective. Suppose, for instance, that some racist persons gain pleasure from not rescuing individuals of a certain race. Presumably, McKee and Richardson would decline from counting such racist pleasure as positive utility adding to social welfare. The general problem with utilitarianism like this is that once the scope of evaluation extends beyond counting specific outcomes like health gain, there are many externalities which even the most hardcore utilitarians will be uncomfortable with if they are included in the utility calculus. Put another way, the utility calculus relies on some prior non-consequentialist judgments on human morality. One could argue that McKee and Richardson's singling out of the externalities from rescue and including no other externality is actually an example of such non-consequentialist judgment. This then simply begs the question of how such non-consequentialist judgments ought to be made. There is another line of consequentialist argument worth considering. This is made by Brock and Wickler themselves, who, as we saw, are critical of the rule of rescue. They nonetheless concede that because of the psychological power of the rule, a policy that ignores the rule would not get much buy-in from stakeholders and donors. The result being that the policy raises far less resources and has far less impact than the one that prioritizes rescue. Put another way, as shown in this graph on the right again, a policy that emphasizes rescue ends up creating more resources for non-rescue interventions than having more impact overall in the end. But we should note that, like McKee and Richardson's arguments just now, this isn't really a defense of the rule, but rather is toleration. Brock and Wickler's intention is still very much to maximize the benefits. They just concede that in certain circumstances, pursuing the rule helps us do that. They have no intention to stick to the rule if the balance of outcomes they're measuring doesn't come out in the favor of the rule. I discuss what Brock and Wickler's intention is because it's important generally to understand the actor's intention when evaluating any moral act. As shown in this table, the green table at the bottom, even when both the consequentialist and the non-consequentialist decide to pursue a rescue, they can do so with very different intentions. But what's most important thing to highlight from this table is that even if you're not a consequentialist, this doesn't mean that you cannot consider consequences at all. You can still consider the consequences without this being the sole or the main motivation for the decision to pursue rescue. That is, you can choose to pursue rescue because it is the right thing to do, while also foreseeing that this might indirectly lead to greater resources and impact overall. I'd argue that this reasoning is a form of something called the doctrine of double effect. This doctrine is typically applied when good intention and act bring unintended but still foreseen harms as side effects. So, suppose a military general needs to bomb the enemy's critical military infrastructure to protect his country, but the infrastructure is close to civilian facilities and is operated by some civilians. In this case, provided that all due cautions are taken to minimize civilian casualties and is done as the last resort, it will be ethical for the general to carry out the bombing, even if it can be foreseen that civilian casualties might result. This will be because the general's intention is to damage the enemy's military, not to harm civilians. In the case of rural rescue, the indirect side effects are not harms, but benefits in the form of extra resources. And it's perfectly fine for a non-consequentialist decision maker to consider these indirect benefits. And and even pursue rescue in a way that brings the most indirect benefits, all other things being equal. Okay, so we've now covered the failed defense of the rule of rescue from the consequentialist perspective. There are other defenses put forward by modern bioethicists, which I cover in my dissertation, but I won't go through them now because, in a nutshell, I don't think they're successful. We now come to the issues and objections raised by people who are opposed to the rule. So I list here the three things which I think are the core and foundational issues. First, the role of inclinations in human moral reasoning. Second, relationship between justice and charity, and solidarity and its limits is the third one. All right, let's take the first issue of the role of inclinations. The argument here is that the human inclinations, like the instinct to save, are what we tend to do, which should be distinguished from what we ought to do. As the bioethicist Nancy Jecker puts in this article quite memorably, humans have raped and plundered based on inclinations for all of human history. It hardly follows that there is a prima facie obligation to respond to lust with rape or to rage with plunder. So accepting inclination is tantamount to accepting these bad behavior. So the general concern is that if we simply read off what people happen to do and build an obligation into it, we will be committing the so-called naturalistic fallacy, or is-ought gap, where an is arbitrarily converted into an ought. We encounter this line of argument again and again around the rule of rescue, and it's marked by a sharp mistrust of pre-rational human capacity like emotion and intuition. So we can label this argument the rationalist critique, where being rationalistic is different from being rational. There is also an interesting evolutionary spin to this argument when it's applied to identified person bias. A good example, sorry, that's not the Nancy Jacker's article. Sorry, I was looking at the wrong thing. So that's the article by Randall Moore. So a good example of this evolutionary spin is this article by Randall Moore. According to Moore, for the vast majority of our evolutionary development, we have lived as hunter-gatherers in small communities with no more than 150 members who interacted face-to-face on a daily basis. In this context, the propensity to help one's kin improved one's inclusive fitness and therefore the ability to transmit one's genes. Moore's concern is that we are no longer hunter-gatherers, but modern citizens living in a large society with largely impersonal ties between ourselves. For Moore, the kinship-based altruism of our hunter-gatherer days gets, quote, overgeneralized into the identified person bias today. And this overgeneralization prevents us from being rational, where being rational is defined by Moore as being utilitarian, though he doesn't explain why that's the only form of rationality. All right, we turn to the second core issue, the relationship between justice and charity. For context, most people are familiar with the parable of the Good Samaritan, and has always been held up as the classic story of rescue and its normative significance. But according to this article by Nancy Jecker, that's her article, it's the same article, people are mistaken for reading the parable in that way. The Samaritan had no legal or social obligation to help the robbed stranger dying on the street, but he took on considerable risk and expense to rescue that stranger. According to Jecker, such charitable acts are certainly praiseworthy, but they are not relevant for public policy or law. Charity is a private affair, something one does for a special relation. By contrast, public affairs should be governed by justice instead. This raises some important questions. First, what counts as a special relation? Family and close friends, certainly, but what about an encounter between a doctor and a patient? Or indeed between the Samaritan and the robbed man he doesn't know? These encounters are sometimes called circumstantial encounters because they are brought about by specific circumstances like illness or robbery rather than family ties. Jecker is firm that these circumstantial encounters do not count as special relations. Her argument for this is that modern communication technologies have eliminated any significant difference between needy persons you happen to encounter physically, say at an A&E department or on the street, and those who you can identify and help online through charitable donations. The conclusion then is that circumstantial healthcare encounters should not be an occasion for charitable acts like rescue, but should instead be governed by justice. Second, if healthcare encounters should be governed by justice, what does this justice look like? Here, Jekyll adopts the Rawlsian understanding of justice. So you see here John Rawls, A Theory of Justice, a very influential book, under which public policy should promote equal social opportunities. This means that public policy should prioritize early life prevention to ensure that people enter adulthood with comparable health and educational endowments. This essentially means that in public healthcare, there is very limited scope for rescue for generally older people in severe immediate need. Another question that might be asked is, if you somehow find yourself having to choose between pursuing justice or pursuing charity, which should you choose? Here, Jekyll is clear that justice takes priority over charity or beneficence. So beneficence is when an individual doing something good for another individual, and charity is kind of a subset of beneficence. This is because beneficence is essentially narrow-sighted, only focusing on what is the most pressing need at the given moment, and not considering how benefits and costs are distributed in society. This is Jekyll's opinion. By contrast, justice considers the broader factors that determine the fair allocation of public resources. Justice should therefore be prioritized over charity, and this further shrinks the opportunity for charitable rescues. All right, so we come to the third core issue. This isn't an objection to the rule as such, but an issue that demonstrates the difficulty of defending the rule. So in the past decade or so, there's been a lot of academic articles and books written on the topic of solidarity in bioethics. The general consensus in the literature is that solidarity means something like standing together or bearing the cost of the other. Or if you want a Christian version, as St. Paul says, carry each other's burdens, and in this way you will fulfill the law of Christ. The increasing use of solidarity concept has been welcomed by many ethicists like Angus Dawson and Marcel Verwey in this article, who are always concerned that modern bioethics is too individual-focused, concerned almost solely with the duties and rights of individual clinicians and patients, and much less, if at all, on what the community as a whole owes to individuals and vice versa. Dawson and Verwey make an interesting distinction between rational solidarity and constitutive solidarity. Rational solidarity occurs when individuals group together to seek their self-interests more efficiently. So I might contribute to a mutual healthcare insurance in the understanding that I will eventually receive healthcare when I'm sick. By contrast, constitutive solidarity occurs when individuals contribute to a cause fully knowing that they will not receive any direct benefits in return. But they still do so because they identify with some communal value or meaning such that they receive indirect and often intangible benefits from knowing that they contributed to the common cause. Very interestingly, one key example of constitutive solidarity given by Dawson is a decision to fund medical care for very rare congenital diseases, precisely as NICE does with the HST program. This is because people who are not born with a congenital disease wouldn't support the funding because they might benefit from the care in the future. They wouldn't. And because the disease is very rare, people wouldn't generally be concerned about their future children having the disease either. That is, to the extent that they do support the funding, they do so because they identify with the plights of those affected by the disease and because they gain the indirect benefits from knowing that the rescue care they fund contributes to the common cause. So we might wonder at this point whether we found the solution for defending the rule of rescue. Constitutive solidarity motivates precisely those collective endeavors that go beyond narrow self and short-term interests. And policies like NICE's HST program are held up as classic examples of constitutive solidarity. One might then be quite surprised to find that Marcel Verwey, in this article at the bottom, book chapter at the bottom, is actually skeptical about whether solidarity concept can defend the rule of rescue. He actually has a critical concern about the solidarity concept, even as someone who seeks to revive its use. The issue is this: for there to be solidarity, there first has to be a community, and the nature of that community, particularly its shared narrative, determines the kind of solidarity pursued by that community. But what do we do if the community happens to be bigoted, deliberately excluding some groups and individuals from shared resources? What if its communal narrative is built precisely around vilifying some minority groups or rival communities? Wasn't the 20th century marked by moral atrocities motivated precisely by this kind of exclusionary narrative and ideology? The critical issue here is that a given community and its narrative must be held accountable to a reference community and a reference narrative which are sufficiently universal and benevolent. Without such reference point, it becomes impossible to judge and restrain exclusionary forms of solidarity. And if so, so-called solidarity could justify bigotry and discrimination as means of strengthening group cohesion and identity. This so-called solidarity could also justify state power and communal coercion that trample on individual dignity and freedom. Secular bioethicists who support the concept of solidarity are, of course, aware of these issues and have suggested various ways of conceptualizing a universal form of solidarity. I don't have space here to go through these suggestions. Suffice it to say, at least according to my reading, they're not successful. And I think this is generally accepted in the field. As one prominent scholar in the field puts it, quote, the we or us in solidarity always imply a they. So it appears that giving a coherent philosophical defense of Good Samaritanism is still out of reach. The Good Samaritan, of course, puts aside the distinction between us and they and rescues a stranger who comes from a hostile tribe because Jews and Samaritans really didn't get on. The Christ commands us to act like the Good Samaritan, though. So it seems that the concept of solidarity, at least in the forms proposed by secular bioethicists, cannot quite reach up to Christ's moral standards. So, having reviewed what I think are the three core issues or objections, the Thomistic defense of the rural rescue is organized around responding to these issues. I'll first defend the normativity of human inclinations under the natural law framework. Second, I will argue that justice and charity are not rivalrous concepts, rather, charity perfects justice. Third, I will argue that true universal solidarity is found in Christ, and that precisely is the good news, the gospel. Then finally, I will situate the pursuit of the rural rescue within a virtue ethics framework where the virtue of prudence plays a key role. All right, natural law. No smaller issue than that to explain in 5 minutes. All right, according to the prominent scholar of Aquinas, Survey Pinker, natural human inclinations are not some annoying hindrances to human moral decision making. Rather, they are located, quote, at the very origin and principle of morality. Divine providence guides all creatures through, quote, inclinations to their proper acts and ends, and to be subject to divine providence in this manner is to be governed by the natural law. Oftentimes, people think of religion as a set of externally imposed rules that make life generally miserable. They see God as a strict, inhumane schoolmaster. But this is completely opposite to the biblical idea of God and how God instructs humanity. The key insight from the natural law tradition is that God does not impose external moral rules, but rather ingrains in our hearts the inclinations to do the right things. To paraphrase St. Augustine, the 10 Commandments revealed by God to Moses is not an arbitrary set of external rules, but a divine reminder of the natural law written in our hearts and our inclinations. That's why it's sometimes said that those who break the natural law by stealing, for example, harm themselves more than they harm others, because they're contravening the very laws written in their heart and consciences. Another key feature of the natural law tradition, which often causes confusion, is what is meant by the adjective natural. Nowadays, when we hear the term natural, we are accustomed to the meaning used in the natural sciences to explain a phenomenon that occurs with high statistical frequency. By contrast, in the natural law tradition and in ancient philosophy more generally, natural is what perfects the given being and describes by corollary what that being ought to be. To illustrate graphically, you could say that natural in natural sciences describes what goes on at the top of the normal distribution bell curve, while natural in natural law is concerned about what is at the very fringe of the bell curve. Though this is a very bad analogy, the natural law isn't concerned about statistical frequency at all. We can give an example of the natural law sense of natural. So when we describe a virtuoso musician or an elite athlete, we can say something like, these complex techniques come so naturally to her. Here, we're not talking about statistical distribution of artistic or athletic ability in the population. Rather, we are talking about perfection of that ability in a given person. Another good example of this sense of natural is saints. Although saints' lives are marked by miracles, the Christian tradition says foremost about them. What they say foremost about their lives is that they lived a supremely natural and supremely human lives. That is to say, in their hugely varied ways, marked foremost by charity, the saints live as human beings are supposed to live. And I would argue that this natural law sense of natural is evident even today whenever we ask what anything really is. So if anyone asks what is a health economist, or what does the health economist essentially do, I will start listing activities like ensuring that the health system runs sustainably or advancing technical methods in health economic evaluation. It's not that every health economist does these things day in and day out or does them well. It's describing what a health economist in an ideal understanding of that profession ought to be doing. And this is essentially how education works. When a student trains to be a health economist, the teacher shares journal articles and techniques that demonstrate what a health economist ought to be doing in an ideal understanding of the profession. So the bottom line is that in many instances, you cannot separate an is from an ought. What something is incomprehensible without understanding what it ought to be, and vice versa. There are, of course, legitimate instances where you should separate an is from an ought, particularly if when by is you're talking about what occurs with high statistical frequency. But in other cases, the separation doesn't make sense. Overall, one should conclude that the notion of naturalistic fallacy that's so often used to exclude inclinations like rule or rescue from moral reasoning is itself fallacious. Followers of Thomas Aquinas have, of course, been making this argument for a very, very long time, and has now found its way into the bioethics literature. So I just cite this article by Mark Sheehan, who's also at Oxford, who essentially makes an argument that is-ought gap is very flawed, and we should respect the inclination to rescue, just like we respect the inclination to achieve fairness or to prioritize the worst off. All right, this, however, leads to Nancy Jecker's objection, and here she's actually responding directly to Mark Sheehan's article. For Jecker, as discussed already, following natural inclination is tantamount to endorsing lust, rape, rage, and plunder. It suffices to say in response that Christian theologians are sharply aware of this danger of blindly following our inclinations. The doctrine of original sin essentially teaches that our inclinations are wounded or out of tune relative to what God desires for our lives. In short, privileging natural inclinations does not mean following inclination whatsoever, any inclination whatsoever. If anything, Thomistic ethics is very much concerned about how to rationally discern our natural inclinations. Aquinas suggests several ways in which this can be done. First, Aquinas notes our human beings have distinct categories of inclinations that are hierarchically ordered. We first have the inclination of self-preservation, shared with all created beings, then the inclination to procreation of bringing us offspring, had in common with all animals, and then we have this third category of inclinations that are unique to human beings. We have the inclination towards rationality. And here Aquinas notes three examples of rational inclination: the inclination towards truth, religion, and sociality. The key for Aquinas is that these inclinations ought to work in sync and to work hierarchically, where other inclinations are governed by the third inclination towards rationality. So the first and second categories of inclinations do not license, for instance, self-preservation at all costs or procreative but non-consensual sex. Following these lower inclinations in such manner is simply not befitting or perfective of the rational nature human beings have. It contradicts our inclination to rationality. Aquinas goes as far as to say that natural human inclinations belong to the natural law only insofar as they are ruled by reason. Another way of saying all this is that our natural inclinations should be discerned by the virtues. In fact, to follow the inclination of rationality is precisely to act virtuously. For Aquinas, to act virtuously is not to impose external rules and inclinations, rather the virtues themselves arise from the inclinations. The difference between virtues and inclinations is that virtues are consciously directed at the most holistic goal for the person. And Aquinas holds that all persons have as their most holistic goal perfect happiness, which people seek in different things like money or momentary pleasure, but which ultimately can be found only in God. So this goal-directedness of virtues give another regulating principle when discerning between inclinations. We can ask ourselves, would following this inclination make me happy, and make me happy consistently and persistently? By that principle alone, we can rule out rape and plunder as rightful pursuits of our inclination. All right, inclination to sociality. I now want to focus on one of the rational inclinations which is most relevant to today's topic, and that's rational inclination to sociality, which Aquinas holds to be unique to human beings. But you might then ask, what aren't other animals also social? Wolves, for instance, hunt in pack. You could even argue that some animals are more social than human beings. Aquinas is aware of this objection, but still holds that there really is something unique about human sociality. While other animals hunt and eat together, human beings are unique in being able to communicate in material goods like ideals and truth. That is, human sociality is highly cognitive and finds its perfection in friendship, as we'll discuss in a bit. Human sociality is also highly imaginative. That is, each person is capable of an act of imagination that identifies oneself with another in a way that transcends family ties or physical proximity, thereby potentially making the friendship or love universal. And such universal and imaginative sociality is best showcased, Aquinas argues, in our tendency to rescue. This is what he says. Now, it is natural to all men to love one another, a proof of which is that man, by a kind of natural instinct, comes to the assistance of anyone, even unknown, that is in need, as though everyone were intimate and friendly with his fellow man. The phrase "as though" is critical. Aquinas recognizes that we are not, in fact, intimate with persons outside our circles of special relations, but we can and should use our imagination to overcome this barrier in circumstances of need. This is indeed what the Good Samaritan achieved for the robbed man who actually comes from a hostile community. The bottom line is that, according to Aquinas, the rule of rescue, particularly if practiced on strangers, circumstantial relations, and even enemies, derives from this uniquely human inclination to sociality and is potentially perfective of the human person. Right. To conclude the argument thus far, one should not reject the normativity of rural rescue simply because it's a human inclination. All other things equal, we do have an obligation to follow the rule as an expression of the rational human inclination to sociality. To accept this is not to commit a naturalistic fallacy, but rational discernment of inclinations through the virtues is still important. The rule is not simply a matter of private morality either, because public authorities have the mandate to foster it insofar as human beings are social creatures who flourish within and as a community governed by such public authority. All right, that's next slide. So we now come to addressing the second core issue about the relationship between justice and charity. Here, the key theme or principle is that the aim of any virtue, be it justice or charity, is to perfect the individual person. And to do this, of course, we would need just distribution of resources and just institutions, but these are means to an end, and that's the key insight. Put another way, justice is a virtue that derives from the rational inclination of sociality, but the inclination of sociality does not stop after achieving justice. Once justice is achieved, it must hand over the task of perfecting the individual to virtues of equity, friendship, and charity. And these latter virtues do not rank lower than justice, rather, they perfect justice. Let's take the first of these later virtues, equity, translated from the Greek word epikeia. Nowadays, when it comes to discourse on healthcare priority setting, the term equity basically covers any concept that motivates a departure from the cost-effective norm. But for Aquinas, the term equity actually has a very precise meaning. It is a virtue to know when to set aside the letter of the law in order to fulfill the essence of the law or justice. Such situation can arise when a law or policy set by a high public authority is generally just, but happens to be unjust in specific situations. In this scenario, the virtue of equity motivates the lower public authority or even private individuals to act according to the spirit of the law, and by that process achieve justice without exception. So I put some photos of cricket because sometimes the spirit of the game gets mentioned quite a lot, even though something goes against or according to the rules of the game. We come across situations like this, as I said, in sports, but probably the best reflection on this is Victor Hugo's novel Les Miserables, where policeman Javert really allows no exception to the letter of the law, while Jean Valjean is kind of ruled to himself, not by breaking the law, but by charity, discerning what is the rightful application of that given law and justice. So interestingly, Aquinas argues that the virtue of equity is most important when it addresses, quote, manifest and urgent needs. That is, if it involves a rescue. For example, he argues that although private property does not in general contravene the natural law and is consistent with the principle of stewardship, if a very serious need arises, such as imminent danger, it would be just for one to take another's property to address that need. And I argue that the virtue of equity is expressed for rescue is already applied in healthcare funding, although we don't quite appreciate it. One example is a process called individual funding request managed by local healthcare commissioning bodies. These funds are allocated to treat individuals in exceptional clinical circumstances as assessed by their personal clinicians. That is, the commissioning body accepts the claims for funding made by clinicians on behalf of their identified patients. The second example of equity, I would argue, is NICE's HST program. We could regard NICE's prioritization of cost effectiveness as a policy that is generally just, but which can become unjust in specific situations like ultra-orphan drugs. The HST program restores equity, that is. And to resource these specific situations, NICE will be justified in introducing stricter cost-effectiveness norms for general non-rescue cases. I want to cover the second virtue that perfects justice, and that is friendship. Aquinas is clear that justice is the prerequisite for friendship, since inequality can only be detrimental to true friendship. It thus belongs to justice to reduce unequal things to equal ones, he says. However, he doesn't think that our inclination to sociality just ends at achieving justice and equality. In fact, it's only the beginning of friendship. And this is because friendship for Aquinas plays a greater role in perfecting the person. So that's that principle again, it's about the perfection of the person, since friendship is spontaneous, not created from moral debt or legal obligation, which is governed by justice. And friendship is also important because it lays a natural foundation for charity. So charity obviously has a non-religious meaning nowadays, but it also has a very specific theological and Christian meaning. And this theological meaning, charity is friendship with God, which brings about the, quote, supernatural perfection of our inclination to goodness, including our inclination to sociality. So in the Christian tradition, theological charity is marked by radical sacrificial love, particularly for a neighbor's urgent need, i.e. for a neighbor's rescue. Another effect charity has is that it dramatically expands the definition of who my neighbor is. God sends his rain on the just and the unjust. And if you're friends with God, we must be ready to practice forgiveness and to recognize that even the most unjust persons are still loved by God and therefore deserving of our rescue. This has an important implication for our topic of rescue. We have seen that a key distinction used by bioethicists like Jecker is between special relations and circumstantial relations. One might contemplate rescuing a special relation but not circumstantial relations. Well, theological charity challenges us to break down this distinction. In charity, these distinctions between these two relations, strangers and even enemies, largely disappear because all are special relations in God. All right, there's a lot I'm trying to cover. As I said, please reach out if you're not following the argument, but we're now on to the third core issue, solidarity. Solidarity is, of course, an excellent topic for comparing and contrasting secular philosophy and theology, because solidarity is an important theological concept too. So it's actually one of the four main pillars of Catholic social teachings, and it's been defined in papal encyclical as, quote, a firm and persevering determination to commit oneself to the common good. Aquinas never actually uses the term solidarity, but his followers do and have worked on that concept in Catholic social teaching. And the key takeaway from the theological research in solidarity is that it is a virtue practiced by individuals and institutions alike, which derives from a rational inclination to sociality. According to O'Connor, the virtue of solidarity facilitates the link between justice and civic friendship. Importantly, the theological solidarity largely affirms the essence of the concept of standing together, bearing the cost of the other, and bearing each other's burden, particularly in exceptionally urgent situations. The bottom line is that we can conceive the rule of rescue as a principle and practice flowing from the virtue of solidarity, just as we have seen the concept of constitutive solidarity in bioethics allows us to do that only partially. But then this kind of leaves the crucial question of why the constitutive solidarity didn't work when it came to secular bioethics. The crucial question is whether a theological understanding of solidarity can address the main shortcoming of the secular concept of solidarity. This was the absence of a reference universal community and narrative, which can result in exclusionary forms of solidarity. I mean, you wouldn't be surprised to find me arguing that theology can affirm this universal community and narrative, and do so at two interrelated levels. First, the natural law concerns the universal providence of God. It's therefore binding on all members of the human race simply by the fact that they are human. And the virtue of solidarity from which the rural rescue receives normative status is a universal virtue, therefore. The theological natural law tradition hence brings this absolute commitment to universality. And as Tom Holland's book Dominion makes the case, the Western civilization's strange obsession with universal values, universal human rights, for instance, which they themselves never live up to, is incomprehensible and undefensible without this natural law commitment that lingers on in our post-Christian culture. This natural law conviction is definitively vindicated by the gospel, often called the divine law. Jesus Christ is not only the Jewish Messiah, he is the new Adam or the new humanity. He is God who has united the whole of humanity within his personhood. Christ died not only for the elect or only for those who go to church every Sunday. He died for all of us. He rescued all. Hence, God in Christ forms the universal community prior to any human efforts to create a community or narrative. He is the universal community and he is the universal narrative. And he offers the invitation to all, both inside and outside the visible church, to join this universal community, the body of Christ. At this juncture, and I'm aware of the time, and we're nearly in the final section, we encounter an important objection to the line of thinking we've been tracing. And it comes from Charles Fried, who was a very influential Harvard law professor, and he served in multiple US administrations. He just passed away in 2024. He was also a very hardcore consequentialist, and he was very disturbed by the frequency of identified person bias that occurs in healthcare and also in the legal criminal law field as well. And he argues against the rural rescue like this. He first actually accepts that rescue does derive from friendship, which also represents an opportunity to quote, show our deeper humanity. So he accepts that kind of core argument. However, he argues, if our sociality is so imaginative, if we are all special relations to each other, if we are all part of a universal body, then why can we not relate with future identified persons in the way we relate to currently identified persons? Why are we, through rescue, privileging the currently identified persons and not recognizing that by neglecting prevention, we are inflicting the same harm on equally identified future persons? So I think this is a critical objection. I call this the equal identifiability problem. So both current and future persons are identified. And I'll address this in a bit. And this objection pushes us into the final segment. And until now, the case has presented kind of more or less an abstract and absolute reasons for why the rural rescue should be a principle that is pursued, all other things being equal. But reality is never black and white. Other things are never equal. And resources are finite, which means that the decision to conduct rescue today does carry opportunity costs, not only in terms of prevention opportunities forgone, but also other rescue opportunities today and tomorrow also forgone. And an ethic that ignores this reality is a very flawed one. And this brings us to the so-called virtue ethics framework within the Thomistic ethics. Virtue ethics is hardly mentioned in government or academic literature on healthcare priority setting, but I would argue that the framework is actually widely applied, though under different terminology. So NICE, for instance, seeks excellence in health and care, which is precisely what virtue ethics seeks to do for any decision-making agent or institution, and the clue is really in the name, the excellence. I believe the virtues can be conceptualized in using modern terms as distinct and incommensurable qualities of decision criteria that are not reducible to each other, cannot be traded off against one another, or as specific exchange rates, or aggregated to a single outcome. So you cannot say, for instance, our healthcare system is really inequitable, so we will make up for that by making it more efficient. Just like you can't say, I'm a really bad father at home, so I'll improve my medical statistics skills at work. Efficiency and equity are simply distinct domains of performance that cannot be aggregated to a single metric. but they are obviously related and ought to be related. So theologians sometimes talk about the unity of virtues or the close coordination of virtues as an ideal. The virtues can also be ordered. So you can say equity is a higher virtue than efficiency because NHS was founded on the principle of equity. This doesn't mean that equity has to be pursued all the time and efficiency ignored all the time. In some cases, it is proper to focus on efficiency, though always with the intention that this would directly or indirectly lay the foundation for equity later on. This can be done even if unintended cost occurs in the form of equity forgone in the short term. This is an application of the doctrine of double effect, which we discussed already. Something broadly similar can be said about Christian virtue ethics framework, where charity is the end and the highest virtue, and other virtues are oriented towards charity. So, and all these evaluative processes are carried out by the virtue of prudence. So it is prudence that seeks to keep the order of virtues intact, so the decision-making agent is able to move towards its overall end in an excellent way. This would involve reviewing the real-life context to identify, for example, circumstances that require the application of the doctrine of double effect. So you could say that prudence, while very important, is not an end in itself. It is the engine of the vehicle, not the destination of the journey. And probably most important for health economists, efficiency can be conceptualized as a sub-virtue of prudence. And that's the argument made by the Oxford moral philosopher John Finnis. You see his book on the right here, Natural Rights. It will be imprudent to waste resources, and it will be imprudent to expend more resources to obtain the same outcome. And this is a very important insight. Efficiency or cost effectiveness is a virtue, and it is a virtue that is a part of prudence. But just like the prudence itself, it is an engine, not the end in itself. So let's now finally explore how prudence can be applied within a virtue ethics framework to implement the rule of rescue in real life. The first important role of prudence is to identify and exclude abuses of the rule. And I give some instances of abuses, but I think the last one is probably the most important. I think the third issue comes about because there are actually different ways of being identified, and it may be that we are unfairly advantaging one way over another. So, for example, certain groups in the population just get greater national media coverage or have greater political connection. Prudence should strive to establish a fair identification process such that rescue doesn't become a popularity contest. The second role of prudence kind of directly answers a Freed's equal identifiability problem. So remember that Freed's argument was that there cannot be any meaningful distinction between rescue and non-rescue interventions because both ultimately affect identified lives. If you have the imagination and so forth, we shouldn't basically make that distinction between rescue and non-rescue. The main trouble with Freed's argument is that it neglects the difference between the nature of the act between rescue and non-rescue intervention. The nature of the act is a critical moral criterion as seen in this table. One could have two strategies with identical intention and consequence, but have very different natures of an act. So in this red table, some investigator is trying to find more information. It has two options. You can torture that person who's an accomplice to a crime, or you can kind of give him a big financial incentive. And for the sake of the argument, both strategies bring equal consequences, right? And the investigator has same intention. But what I think most people will agree that the nature of the act of torture is intrinsically wrong. So you would, in every circumstance, even if the consequences come out in favor of strategy one, pursue strategy two. We have a similar dilemma, I would argue, when it comes to choice between rescue intervention and non-rescue prevention. It's not as dramatic as the torture example, but we should still consider the nature of the two acts. Because rescue is highly consonant with a sense of vocation and narrative that generally motivates healthcare professionals and institutions. It's incorporated in the Hippocratic Oath, for example, and it's the main motivation for many who join the medical profession. And it forms the professional expectations in the medical community. And actually, interestingly, virtually every critic of the rule of rescue accepts that the rule of rescue is a vocational act, including Freed himself. So, in a nutshell, deprioritizing rescue is a kind of act that erodes the very essence of medicine as a practice with its own standards of perfection in a way that deprioritizing prevention is not, relatively speaking. This is particularly so if you consider that the most effective preventions are those that take place outside the healthcare system. Most improvements in life expectancy, for example, have come through improved nutrition and hygiene brought by better education and economic development. That's a good example in the 20th century. Therefore, the prudence's role is to consider not only the direct consequences of alternative decisions, but also the nature of the acts, particularly in relation to the vocations espoused by the agents and institutions carrying out that act. And in that case, if the direct and indirect benefits of the rural rescue come out similarly to prevention, that gives an even stronger reason for pursuing strategy 1 in the green table rather than strategy 2. All right, so the final role of prudence comes about because this doesn't, what I've just said above about there be considering the act, still doesn't consider the scenario where the opportunity cost of rescue is simply too high. So even after considering the nature of the act, the agent's vocation, the indirect benefits, and so forth, we can have a situation in real life where the opportunity cost of pursuing rescue over prevention or non-rescue intervention is very, very, very high. And as noted above, prudence, efficiency, cost effectiveness must consider the magnitude of this opportunity cost, even if this is not the main precision criterion. So we are in need basically of applying the doctrine of double effect as we've discussed already multiple times above. Specifically, while keeping the order of virtues intact, with solidarity and charity as the highest virtues, it is legitimate for healthcare decision makers like NICE to refrain from current rescues with the intention of pursuing rescues sustainably over the long term. The opportunity cost of current rescues forgone are the unintended costs associated with this intention. But as long as the intention and the order of the virtues remain intact, this will be legitimate under a Thomistic ethics. All right, final slide. In all this, in being prudent healthcare decision makers, Christians should remember that their own sense of vocation, which comes from Christ himself. Christ is the shepherd who leaves behind the 99 sheep to search for the one requiring rescue. And here, the one lost sheep does not stand merely for those who are trapped in mines or those born with serious congenital illnesses. It stands for the whole of lost humanity. We all are that one sheep who was rescued by Christ. We are then reminded of that parable of the ungrateful debtor, where a servant who has been forgiven and rescued from an astronomical debt by a king goes after another servant who owes a paltry debt to that first servant. We are that ungrateful servant, then, if we do not creatively seek ways of rescue, without, however, compromising the ability to conduct rescue over the long term. Therefore, the gospel challenges us strongly that after having conducted all prudential assessments exhaustively, to search once more for the scope of mercy for those in dire immediate need. And that final picture there is just a shout out that the film Saving Private Ryan is essentially Spielberg's meditation on the same issue. So you have, Private Ryan, who is identified, right? His mother wants him back. His brothers are all dead. So it's an identified life. And the general is in dilemma, as are the 9 men sent to rescue Private Ryan. So for the 9 men, they are identified to themselves, right? It doesn't make sense why 9 lives should be sacrificed for that one life of Private Ryan. And I think in the middle, I think Captain Miller has this discussion with his team members, and he basically says he doesn't know who Ryan is. It's not identified to him, but if it is basically his vocation as soldier to soldier on and to follow his duty to rescue that Ryan. And Ryan himself follows his vocation to stay behind on that bridge to defend and make sure that the landing is successful. So all sides end up following their vocation, and following that vocation kind of ends up bringing benefits that haven't been foreseen at all by those involved. So we should always give that kind of opportunity to consider the scope for rescue and mercy, even though we cannot quite figure out the direct and indirect benefits that would accrue. So I'll end there.